Great. So thank you so much. I mean, what mixed feelings that my hearing today came up just at a moment where, or a day where I really wanted to be home. Atlanta is home for me, and Sandy Teman, who is sitting right there, and I have been texting, and I can't tell you how much I was planning to join you all for this very important anniversary, and then subsequently hang out with the good friends and most of you in this room. So let me first of all start by extending my congratulations. Congratulations to the task force for your 40th anniversary. Well done. And your achievements speak for themselves. Facilitating or enabling the vaccination of children, raising that number from about 20% to 80% is a clear indicator of how successful the task force has been. When I look at your achievements, I also look at its founders, and I'm very honored and privileged that and intimidated that I'm speaking after Bill Fege, who just gave an eloquent presentation. And I wish that I spoke before him so that I could clear the way for him, for you to leave with that very powerful message that he just delivered. I've never met Bill Fege before, and so I was truly hoping that this would be the highlight of my Global Health career, to finally meet the person that I've read a lot about. So in the coming minutes allotted, I will do four things. I would take a step back and submit that Global Health finds itself at the crossroads. That Global Health is at the crossroads now, and I'll explain and share my reflections as to why that is. Then secondly, I would try to derive or weaponize that thinking by borrowing from the history or the stories of smallpox eradication and elimination. Then discuss a little bit about my experience setting up the Africa Centers for Disease Control and Prevention, and then end up with PEPFAR, and I will characterize PEPFAR as the greatest inequality equalizer that I can think of in my 35 years career in public health. So let me start with my submission to you all that Global Health finds itself at the crossroads. When the task force was created in 1984, the word Global Health was not at all available. And if you look at literature, which when I was preparing for this lecture, I actually did some extensive research. The first time that the English language started carrying the word Global Health was in the 90s. And it marked the transition from international health to global health. And international health itself derives its root from tropical medicine or colonial medicine. So global health is a fairly recent concept, and which we are still at some point grappling with what is it that we are dealing with, and what is the basic definition of global health. But it reflects a shift from international health to global health, which is a recognition that the issues that we're dealing with are transnational and they are interdependent in nature. So it just cannot be international health, which is by definition the health of people that we in the global north most of the time used to go to the global south to solve the problems there. So when you look at that, in the 1990s, global health started emerging, and in 2000, it started becoming widely used. And that coincides almost at the same time that HIV/AIDS, the response to HIV/AIDS received great attraction. HIV/AIDS in the year 2000 was the first disease that received the UN General Assembly discussion. In 2001, it's the first disease that ever received the UN Security Council Resolution 1308. And in 2002, the Global Fund was created and mobilized billions. And then in 2003, PEPFAR was launched. All of that, if you look at the trajectory of funding in global health, it actually helped propel the field of global health. So I just like to make a mental note there, and I'll come back to that. So why do I think global health is at a crossroads? I mean, we are at a point in global health where we either go somewhere anywhere or nowhere, based on the complexities and the emergence of institutions, systems, and structures that have emerged. If I trace back to in the mid to the late 90s, the institutions and systems that have evolved or have been established to address global health issues, they are just impressive. And that's good to have that. It's good to have an interest. It's good to have the emergence of institutions rallying around a common problem. As Bill Fage said, maybe the future is to rally around an outcome, and regardless of your institutions, and try to solve that problem. In 1996, the UNAIDS was created. And fast forward, the Gates Foundation, the Gavi, the CEPI, the FINES, the Africa CDC, the UNITED, all emerged during that period. And between then and now, the field has become extremely busy for a good reason, which means we have enough resources, institutions, capabilities, and capacities to solve a problem. But we now are faced with an issue of how do we govern ourselves? How do we govern ourselves so that the issues that we are trying to address are addressed with efficiencies and effectiveness? When you look at the history of smallpox eradication, there are two books that I've read, and I continue to read those books in my own struggles and challenges as we address the HIV response. The first book is by Donald Anderson. It's entitled The Death of a Disease, the inside story of eradicating a worldwide killer. Then the second book is by William Fage, and it's The House on Fire, The Fight to Eradicate Smallpox. Those two books are extremely interesting. In one of them, and especially from this perspective of telling their stories, they tell their stories, and by telling their stories, their own experiences, we learn from it. A lesson that I learned from Donald Anderson's book is about his leadership at the WHO in eradicating smallpox, where he abides by the rules of WHO, but also work around the rules of WHO. Where an outbreak is declared, he has to send vaccines. The vaccines are sent, then you file for a request to send those vaccines. It takes almost a year or two before that application goes through, but it goes through at any rate. But before it goes through, the vaccines have arrived at the destination to solve the problem. Very, very interesting. The second book that I've been reading or read previously, The House on Fire, it really talks about the approach that Bill Fage championed, which is surveillance and containment. And the name, The House on Fire, is actually where a field worker says, well, you start addressing that problem by where the problem is. That is, vaccinate those who are infected, or the surrounding the neighborhood of those who are infected. And rather than doing vaccination, just target your vaccination. And today, when we have Ebola outbreaks, which I've been to North Kivu several times, and with some of you, you start with ring vaccination. So I think those are all concepts that inspired us in global health. When I look at what the lessons that I personally have observed in both learning from the books that I just cited and my own experience in COVID response, Ebola response, and HIV response, there's the concept of we need to know that our pathogen. We need to know our populations. We need to know the right policies. We need to know the politics and partnerships, which was earlier described as collaboration, which I summed them as the concept and the power of 5 Ps. The 5 Ps that apply to most pandemics that we are struggling with and trying to address. So with that concept of 5 Ps, I would now segue to my experience at Africa CDC. Here in 2016, we have just ended the Ebola outbreak in West Africa. And I saw an announcement that the head of states of Africa wanted to establish their CDC. So I went up to Dr. Frieden, who was the CDC director at that time, US CDC at that time, and said to Tom, look, I really need to go. I mean, he said, go to where? So I need to, you can help me, facilitate me to go to Africa CDC to start it. He says there is no Africa CDC. You have to be ready to start at the AU to start that process. But I was determined to do that because I thought that I believe passionately that the continent needed their own centers for disease control, given what we have just saw in Guinea, which was Guinea, Sierra Leone, and Liberia, where Ebola had emerged and surprised us in the capital cities, a disease that was recognized in 1976 in remote areas of DRC and has since spread in many countries, but it was almost contained in remote areas, has arrived in the city centers, and it was devastating. It was scary. It brought almost the entire West African region to its knees. And I thought it was a brilliant idea. I would go help set up the CDC. I arrived at Addis Ababa in January of 2017, and there was absolutely no building. There was no office for me. I had my laptop, and I shared an office the size of a cubicle for 1 year and 1 year and a half. So, but I was so determined that I would invest the concepts of good public health practice and coach and mentor the 12 staff that we had at that time. There were 12 staff that had been recruited to build up that institution. But fast forward, in 2019, COVID hit, and it transformed the organization. It brought the political leadership closer to the reality and belief. I remember the first meeting that I had with the head of states, 15 head of states. My heart was raising in my chest. I've never briefed a head of state before, but suddenly you're sitting in front of 15 head of states in a Zoom camera, and they're saying, with Dr. John, tell us what we are dealing with. Tell us what we have to do with you. Tell us where the support is. You are standing between us and our problems, end of quote. And that is where you matured. You were forced to mature. A young organization that was just 2.5 years old became an adult. I always say that it was a children or a child playing in a men's league. And that is where Africa CDC became relevant, because of the political leadership and recognition of the continent. That's why politics is so important in part of the 5 Ps that I mentioned. So today, Africa CDC is a regional institution, has a staffing footprint of more than 300 staff. When I left there, we've raised more than $1.9 billion, and it had become the agency of the go-to institution to respond to disease outbreaks on the continent. So when you look at the lessons that we've learned from both the elimination of smallpox, the role that a regional institution played, and the innovations that are required, and the multitudes of institutions, systems, and organizations that have emerged since 1990, since the word global health was established, you ask yourself the question, where do we go from here with respect to governance of global health and global health governance, which are 2 concepts that are similar but very, very different. Today, we have a group in Geneva that is discussing the pandemic accord. And they have been in Geneva for close to 2 years. And I think it is safe to say that there is no consensus yet. That tells you the challenges that we face. I always argue in our interagency space that if that accord was supposed to be signed 2 years ago, or at the start of the pandemic, COVID-19 pandemic, everybody would have signed, because everybody was terrified. But it shows us how the neglect that we have in supporting our own institutions for global health, and the panic that occurs when we have to face a disease and what are called pandemic memory loss, and we immediately forget about what has happened and traumatize us. I think it is a place to do a call for action that institutions like the task force should continue to play an advocacy role at the level of Geneva and other countries, so that member states should come together and look at the problem that they need to solve and address that problem and leave politics aside. I think it would be terribly unfortunate if, because of the political differences, the inflection point that the world finds itself, that we fail to have a pandemic accord that will govern us in a way that we should be able to fight the next pandemic. And next to that is the pandemic fund. The pandemic fund was established with a goal to raise almost $10 billion a year over the next 5 years. Today, as we speak, we've raised $2 billion only, short of $8 billion. Again, it shows you where our interest is. It shows you that we all panic during an outbreak or a pandemic, and we neglect that pandemic. And this is going to be true in the whole global health space as we navigate the complexities of domestic financing, global financing, and out-of-pocket financing. Let me just conclude my reflections on PEPFAR, which I described earlier as the greatest equalizer of inequalities. I want you all to think of where we were 20 years ago. The ugly face of HIV/AIDS in Kenya, in Uganda, in Cameroon, in Ethiopia. It was desperate. But today, because of PEPFAR, the Global Fund, and countries' own leadership, we've transformed the trajectory of HIV/AIDS. We've not yet eradicated HIV/AIDS or eliminated it, and we shall never be able to use the two E's, eradication or elimination, because HIV is such a complex disease. Without a vaccine or cure, we'll never be able to do that. But because of the innovations, the scientific discoveries that we've had over the years, we are able to treat millions of people. And PEPFAR has saved over 25 million lives, especially in sub-Saharan Africa, prevented 5.5 million children from being born from HIV/AIDS. But the key question is, where do we go from here? How do we finish the fight? And I hope, as I conclude my remarks, that people like Bill Figge and Dr. Anderson should tell us what we should be doing to eliminate to control such a complex disease. Because each time for HIV, we've thought, this is exactly what we need to solve the problem that has eluded us. Today, we have a goal of bringing HIV/AIDS to an end as a public health threat by the year 2030, which means bring down the rates of new infections by 90% compared to where we were in 2010. And some countries are making progress in that direction. A series of countries have exceeded the 395, which is the need to get 95% of people know their status, 95% receive treatment, 95% remain under viral suppression. But a vast majority of countries are still challenged. So the question is, how do we move a large number of countries to achieving that goal, which we have all stated clearly and rally behind to bring HIV/AIDS to an end by the year 2030? I think the lessons that I learned from eradication of smallpox and smallpox is so essential, is that be creative. We have to be creative and learn some lessons, some tricks that Bill Figge and others use in eradication of smallpox, which is believe in yourself, be adventurous in taking decisions or making decisions that may not be popular at that time, but that will yield the impact. And I think with that, I believe strongly that PEPFAR will continue to, if it's reauthorized for another 5 years, I hope next year that with all of your help, we should be able to get PEPFAR fully reauthorized for the next 5 years. It's the case I just made today during my Senate confirmation. We should be able to one day celebrate the control of HIV/AIDS as a public health threat. So thank you so much for the opportunity, for letting me talk to you via Zoom this afternoon.